Dr. Stu McGill is a professor, researcher, and leading authority on spine biomechanics and the treatment of back pain. Elite powerlifters like Brian Carroll and Lane Norton have worked with Dr. McGill to rehab their own low back injuries, and in the kettlebell world, he's known for his collaborations with Pavel Tsatsouline and Gray Cook. In today's video, we're going to do a deep dive on the top exercises Dr. McGill recommends for core stability and spine health, known as the McGill Big 3. They aren't a panacea for all back issues, but if you have a spine, these moves need to be in your toolbox. So, let's dive in. The first move is the curl up, and this is a bit of a misnomer because there isn't actually going to be a curl or a crunch happening at all. Instead, this is an isometric exercise to build your core bracing skills and strength endurance of the rectus abdominis. Unlike in a crunch or hollow body position, we want to emphasize core engagement while keeping the natural lumbar arch. To do this, place the hands under the low back arch to act as pressure sensors. Bend one leg, foot flat, and keep the other straight. This adds further torque to the pelvis to prevent the lumbar spine from flattening to the floor. We'll begin with short pulses, tightening the abs on the exhalation such that the head and upper shoulders float just up off the ground. The neck and cervical spine stay neutral while keeping the tongue on the roof of the mouth. Once you've mastered the skill of contracting the abs while maintaining the natural curvature of the low back, you can start to add endurance and higher intensity techniques. First, try raising the elbows off the ground and holding the contraction for 10 to 20 seconds at a time while taking power breaths like you might do in a hardstyle swing. Next, really emphasize a maximally activated brace. Squeeze the glute and quads of the extended leg and float the heel an inch up off the ground. Imagine you're trying to crunch against an ab wall of thick steel that simply won't flex. From here, we can use the hands to bring more intensity to the curl up. Use a rolled up towel to sub in as your low back pressure sensor. Push the thumbs against the obliques to encourage lateral bracing. Place the hands beside the head to add more leverage to the abs and core. Finally, take deeper, longer breaths while holding the contraction. The biggest mistakes when performing the McGill curl up come from flexing the neck and losing the lumbar arch. Think about keeping the head and neck as a rigid block. The subtle raise comes from the thoracic spine, not the cervical. And the tongue pushes up on the roof of the mouth to activate the neck stabilizers. Again, don't try to crunch up. The goal is maximal core engagement with minimal movement. Our next exercise is the side plank. Start with a short lever plank. The knees and bottom elbow are bent to 90 degrees. Be sure the elbow is aligned directly under the shoulder. The top hand can add support by grabbing across to the bottom shoulder and drawing down tightly across the chest. Think about pushing the earth away with your bottom forearm. Make a fist and stab the floor. The hips may remain slightly flexed. Keep a long neutral spine and hold for 10 seconds per side. Once you're confident in your side plank stability, extend the hips by squeezing the glutes and add load by resting the top arm along the torso. You can also use the free hand to push into the lower obliques to encourage more stiffness. To further progress the side plank, straighten the legs, placing the top foot in front. This foot position allows you to progress into a dynamic version of the side plank with the rolling technique. Moving your hips and torso as a single unit, slowly roll like a log forward as far as your stability will allow, and then back to the starting position. Finally, the full rolling plank takes you from a side plank to a low front plank to a side plank on the other side. Hold each position for 5 to 10 seconds. The most common mistake in the side plank is allowing the hips and shoulders to go loose and sag out of position. Remember to actively push the ground away from you and keep good engagement through the lats, core, and glutes. We've addressed the anterior core with the curl up, the sides with the side plank, and now the final of the big three targets the back extensors with the bird dog. Adopt an all fours position, hands under shoulders and knees under hips. Reach one leg back, driving through the heel. Reach the opposite arm forward, making a fist. As with the other exercises, minimize any spine movement. The action is with the hips and shoulders. Increase the intensity by really flexing the glutes, quads, and abs, of course, while stiffening the triceps on both arms. Hold for 10 seconds on each side. A dynamic progression on the bird dog is to draw squares in the air with the outstretched arm and leg. You can also bring those floating limbs in to touch underneath the belly button and reach back out. The most common mistakes in the bird dog are reaching the heel too high and overarching the low back, and not actively pushing the floor away. Remember, core stiffness and spinal position are always the top priority. The McGill Big 3 are your low back vitamins, best taken a little bit every day to fill gaps in your core stability. And if you're a power lifter or strength athlete, mastering these types of core drills are absolutely mandatory. I pretty much always include at least one of these exercises in each of my own and my clients' warm-ups. Specific programming certainly depends on the individual, but Dr. McGill often recommends a descending ladder method. For example, performing 3 reps of 10-second holds for each of the exercises, then 2 reps of each, and finally 1. That is the McGill Big 3, and if you want to learn more about another family of some of my favorite core exercises, be sure to check out this video.